name is Hannah.
And I'm Sarah.
Today we are going to be teaching you about AEDs.
Wait, first of all, what is an AED?
Well, an AED is this machine right here.
Seriously.
Okay. Well, AED stands for Automated External Defibrillator. AEDs are computerized medical devices and can increase survival rate after sudden cardiac arrest.
What is cardiac arrest?
Well, cardiac arrest is when the heart starts to beat irregularly.
An AED can check someone's heart rhythm. If their heart rhythm is abnormal or requires a shock, then the AED will send a powerful electrical impulse to the heart. When the heart gets this electrical shock, it can reset and then begin beating regularly again.
The AED has a computer chip in it that can determine if the person needs a shock, and if so, how strong the shock should be. As long as the bystander dials 911, begins CPR, and uses the AED correctly, he or she is giving the victim the best chance of survival.
One of the reasons we have AEDs is because 80% of cardiac arrests happen outside of a hospital or medical care facility. And sadly, out of that, fewer than 8% survive.
That is why it's very important for people to learn how to use AEDs, so we can enhance awareness and improve the likelihood of survival. During the first minute a person is in cardiac arrest, their survival rate is at their highest, and with each passing minute, their survival rate goes down by 10%.
Once turned on, the AED gives verbal instructions that are very easy to follow. It is so easy, even a child can use it.
People have begun to install AEDs in airports, supermarkets, health clubs, workplaces, and government buildings because they understand that an AED can save many lives. This sign represents AED. If you were trying to locate an AED, it would usually be mounted on the wall under the sign.
It is always helpful to become aware of where AEDs are in places you visit often, in case of an emergency. In places you do not visit often, it is also useful to get a general sense of where an AED is, because someone can go into cardiac arrest anywhere.
In an emergency, if you cannot find an AED, you should contact 911 because most ambulances carry one. The dispatcher who answers the call might know where an AED is in the location you are and can sometimes guide you to one.
First, make sure the seat is safe so nobody's at risk. Also make sure there's no water too close to the victim and that the surface they are on is solid and relatively flat. If it is an infant, it has to be on a solid surface above the ground like a table.
Second, turn on the AED. This can be done by either opening the lid or pushing the on button. The AED will then start to give simple verbal instructions.
There are different versions of AEDs like this or that, but they all follow the same simple steps. In the AED, there are different supplies that you may need to use. Some examples are razors to shave the hair where it might interfere with the shock, sterile towelettes to make sure the area for the pads is clean. There also may be a face mask, which is used to give breaths during CPR, and there may be gloves as well.
The AED also includes scissors to open the shirt, so when you put the pads on, the skin is bare. There cannot be a shirt on the victim while you're doing CPR or delivering the electrical impulse. The AED may include some of these things, all of these things, or even none.
All AEDs include shock pads, because that is what you will be connecting to the victim's body to deliver the shock. There are two different types of pads that may be in the AED you are using. There are child pads and adult pads. The child pads are for children 8 and under. The adult pads are meant for people over the age of 8. It can be used for any age if there are no children pads in the AED. Children pads cannot be used for adults because the shock is too weak.
For people over the age of 8, the pads go here and here. If you are ever confused, you can look on the pads and it will show you where on the body to place them. For people, usually babies, that have bodies that are too small to fit the pads in this way, make sure the skin is bare. Then place one pad on the front of the body and one on the back, like this.
Then once the pads are on, shout "clear" to make sure nobody's touching the victim because it can be dangerous.
The AED will tell you whether the shock is advised or not. If a shock is advised, the AED will tell you to press the red button to deliver the shock. If it is not, this means that the heart is beating normally or that the heart has stopped completely.
If you see the victim collapse and become unconscious, check to see if the scene is safe.
Scene is safe.
Ask Ask if they're okay and try to wake them up.
Are you okay? Wake up. Are you okay?
Once you realize the person is not responding, yell for help.
Someone help. Help me. Call 911 and get an AED.
Start to do CPR.
Training load. Call for help. Remove pads or package in back of unit. Apply pads to patient's bare chest as shown. Apply pads to patient's bare chest as shown. Analyzing heart rhythm. Do not touch the patient.
Clear.
Shock advised. Charging. Stand clear.
Clear.
Press flashing shock button.
Clear.
Shock 1 delivered. It is safe to touch the patient. Begin CPR now.
If nobody else is around, you have to call 911 yourself. And remember, try to find the AED as fast as possible because a person's survival rate decreases by 10% with every passing minute.
Now, we discovered a lot of information, but the most important part of this video is knowing how to actually use the AED. So let's review.
Make sure the area is safe for the victim.
Make sure the part of the body that the pads will be attached to is sterile and bare.
Attach the pads to the body in the correct places.
Shout clear to make sure nobody is touching the victim.
Press the red button on the AED to deliver the shock.
Leave the pads in place once put on because they cannot be reapplied. The AED will tell you whether the victim needs another shock. We hope you learned a lot from this video and that if you ever need to use an AED, you would know what it is used for, where to find it, and how to use it.
Please share this video with others to raise awareness, and remember, it could be you that saves a life.